The National Consortium of Telehealth Resource Centers, NCTRC, is structured as a collaborative of 12 regional and 2 national telehealth resource centers, TRCs, funded individually through cooperative agreements from the Health Resources and Services Administration, HRSA, Office for the Advancement of Telehealth, OAT, and the Federal Office of Rural Health Policy, FORP. Working collaboratively under the NCTRC, all 14 TRCs are committed to implementing telehealth programs for rural and underserved communities across the United States of America. The NCTRC also supports the U.S. territories of Guam and American Samoa, the Commonwealth of the Northern Mariana Islands, and the freely associated states of the Republic of Palau, the Republic of the Marshall Islands, and the Federated States of Micronesia. Through telehealth and digitized healthcare, the NCTRC aims to increase accessibility to healthcare in hard-to-reach areas for rural and underserved patients. The NCTRC accomplishes this by assisting healthcare providers, clinics, hospitals, and more to implement telehealth programs that best fit their needs and overcome common telehealth barriers such as billing, reimbursement, and Medicaid policy barriers. All 14 TRCs serve as a gateway into telehealth by providing expert technical assistance, training, and resources to everyone. TRCs often host educational conferences and webinar events to educate folks in specific telehealth areas to strengthen telehealth connections and expanding opportunities across the nation. TRCs are committed to ensuring that everyone has access to safe, effective, and appropriate care when and where they need it, enabling the system to do better for more people. Most rural and underserved areas are often neglected in terms of easily accessible healthcare services. Without accessible healthcare, some patients are prone to putting their health at risk. The NCTRC helps healthcare providers and systems overcome telehealth barriers. If you have an interest in telehealth, reach out to your regional or national TRC. Healthcare providers working in all types of health environments can now provide services to patients, regardless of where they live. Jane works as a healthcare provider in a clinic. She has been looking to get some training in palliative care so she can help her patients that live in rural areas and don't have access to health services. With the assistance from the TRCs, Jane is now able to provide palliative care to those in need. She attended several online events and webinars held by the TRCs, which provided her with the necessary knowledge and understanding. Working as a healthcare professional, Bill has always been a strong advocate for behavioral health. He wants to reach a wider audience and help those in need. With the help of the NCTRC, Bill was able to learn by connecting with his TRC and their educational resources. Now, he can easily provide services to those who are in far-reached areas without any difficulty. The TRCs also provided technical assistance, helping Bill understand billing and reimbursement issues. Jane and Bill aren't the only ones. Their hospital is now adapting telehealth as an integral part of their healthcare delivery system, reaching people even in geographically challenged areas and providing their services to the best of their ability, all with the help of the TRCs. The NCTRC is working to change the way the world thinks about healthcare, one connection at a time. Fill out the NCTRC contact form to get in touch with the TRC and step into the world of digitized healthcare.